with us our very own Secretary of the Department of Health in the Autonomous Region of Muslim Mindanao, in the person of the most energetic and dependable Secretary Dr. ARMM Sinolinding. So, sir, to set the tone, please tell us.
Sir, I think
what brought you here?
this is the first time we have held summit in Brazil. Is this the first time?
Actually, they have held summit before, but I think this is the biggest, and I think this is the most accomplished. Because what we're talking here is the milestone and the achievement that we had in the past 22 months. This health summit is a celebration of victory for our people, based on the accomplishments, based on the interventions that we have done in the past months. And what you are talking now and what we're discussing now are the interventions that we have done since 2010, when I assumed, and until now. And we can say, and we can see from the chart, that most of the status now are improving. Most specifically, the maternal and neonatal mortality that has been plaguing the region, particularly the province of Basilan, for many years. And the trend now is going down slowly and continuously. So yung challenge po natin na nakasalalay po ang buhay ng ating mga nanay at ng mga bata at mga sanggol ay unti-unti nang gumaganda, at ito po ay dahil na rin sa serbisyo na pinag-iibayo nating pagandahin with the help of all stakeholders, including the community, the local government units, the international humanitarian partners, the local NGOs, and most specifically, the community itself.
And we sir, you mentioned during your speech that a lot of money wasted by the previous administration in health.
Yes, that is based on the COA findings that was shown to us yesterday during the Senate budget hearing for ARMM. And it was shown that more than 3 billion pesos was squandered, according to Senator Drilon. It's not my statement, but it's just a reiteration of what has been said yesterday. And if we try to translate that money based on the health, social services, economic services, governance services, then the region could have been at par with the other parts of the country. But sad to say that most of the money intended for the people did not really reach the people. And that is why even the president is very reluctant and very conservative in their optimism regarding the way the region was being governed in the past years.
How did DOH fare compared to the other departments? Do we share that corruption and those that are reported?
DOH was never mentioned, and even now, I think, as already mentioned by our Office of the Regional Governor, the Department of Health ARMM is, I think, tops the list of performing agencies of the Office of the Autonomous Region in Muslim Mindanao.
Okay. So how do you feel about this?
I feel vindicated. I feel I feel so happy because all the efforts, all the concerted and unified commitment, as well as the delivery of services of all health workers has now reached its peak, and recognition has been given by authorities as to performance as well as the translation of the activity into the effect as it affect the lives of the people. So ang nakikita natin dito is improvement of health status by the improved health facilities, improved health services, improved number of manpower, and then above all is the system that we put in place in terms of the health sector.
Sir, sa Basilan po sir, hindi po tayo sa doctor, especially part of municipality, like youth part of Moran, and part of the and Basically, ang sentro po ng services, especially po ng emergency, sa Basilan General Hospital. Kasi sa district hospital, hindi pa gaano kompleto po yung kita natin. So, meron po bang plano ang secretary na yung scholarship program sa mga serving student who wants to be a doctor in the future?
Sa kasalukuyan po, up to this time, the Pinoy MD Scholarship Program is still ongoing. Based on the the data on the lack of physicians in most areas of Basilan and the rest of the region, actually I have been lobbying many times, not only in the Department of Health but as well in the private sector, to place extended services. But reality bites. Everybody's afraid of our region. So the only solution is to send our children to different medical schools so that in the end, they will serve our people. Kaya nga po, when I heard and I read about the article of a physician, a top-notch physician leaving for America instead of serving Lamitan, really breaks my heart. I cannot blame him, but sana naman hindi na lang siya nagpa-interview. Kasi nakakasira po yun sa enthusiasm ng iba na gustong magsilbi sa ating bayan. Actually, he has his personal reason, pero sa akin lang, hindi na sana inilathala sa pakayagan dahil nagkakaroon po siya ng napakalaking impact sa isip ng mga kabataan as well as sa isip ng mga taong hindi nakakilala sa ating lugar. Na iniisip nila, napakawalang pag-asa na talaga ng ating lugar.
Other than
Anong position niyo sa market space? Sabi niya usapan pa rin according to the officials. Parang dito na tayo. What's the position of the secretary?
I have been very consistent from the time I assumed office. I am for RH bill. Not because of any other reason, but because of the fact that each family must have the access to the right information, right services, right quality of life, and the right need for the family. We are not saying here we will reduce the number of families, but we would like to teach our family that the number should be based on their capability and capacity to handle their family size. If they want big, then okay. If they want small, then okay. The biggest problem here and the biggest challenge is to keep our people ignorant about the benefit of the proper way of family planning or the proper way of birth spacing, regardless of any religious reason, which I really and truly respect. The mother and the father and the children of a family should be given priority. Because as we all know, there are so many countries in the world, Catholic countries, even Italy, where Vatican is located, even Rome, they support reproductive health. It is being practiced there, and I don't know, only in the Philippines that we are very active in opposing it, considering the fact that we are a very poor country. Yes, poverty is widespread, the food resources is very scarce, and the job opportunities is very limited. Then why are we keeping our people away from the right information? Ang sa atin lang dito, bigyan natin sila ng tamang karapatan sa impormasyon, sa serbisyo, at yung tamang pag-aagwat na kailangan ng isang pamilya. Hindi po natin sila dinidiktahan kung ilan, kundi binibigyan po natin sila ng power. We empower them so they can decide for their own family and for the direction and the future of their children. Yun ang po yung gusto natin.
From my insight, to get out of things.
Okay. There is already a part about family planning, or we consider it as birth spacing. And ibig sabihin yan, the Muslim community, by analysis and endorsement of our Muslim scholars, do not oppose but rather they encourage each family to decide on their own based on family size, the number of children, based on their capability, both economic as well as their physical capabilities. Islam do not actively go against that, but it promotes a very strong and healthy family. There are 4 recognized reasons why birth spacing is allowed in Islam. Number 1 is if it endangers the life of the mother. Very, very important and very obvious. Second, if the father cannot fulfill his duties as a Muslim because of too many children, and these children will be engaged in illegal activities just to earn a living, then kailangan may birth spacing doon. Pangatlo, pag may mga diseases na propagated in the family as part of the family lineage, yung hereditary diseases, pwede rin siyang gamitin yun na valid reason. Ang pang-apat po, yung tinatawag nating gila. Nagsususo pa yung bata, kailangan mag-stop na siya kasi buntis na naman yung nanay at mga anak. So wala nang pagkakataon na makaproduce ng colostrum, yung fresh na milk, na first milk during pag-anak. No? So nadideprive natin ngayon yung batang inalis mo na gusto pa pagsuso na hindi pa siya sa Bisaya nalutas. Hindi pa siya na-satisfy, and then here comes another child na nakikipag-aruan. So kung titingnan po natin yun, all of them are valid reasons, and these are the reasons why birth spacing is being promoted in Islam.
Sir, ano po yung fatwa?
Yung fatwa is Islamic ruling. Islamic ruling of authority among Muslim scholars authorizing a certain activity, and not only authorizing, promoting. Ibig sabihin, they are not against the teachings of Islam. John, ang number 1 lang dito kalaban namin is ignorance. Marami sa ating kababayan ay hindi alam o kaya kulang ang kanilang kaalaman pagdating po dito sa RH bill. Alam ko po marami at mahabang usapin ito because of the strong opposition of many sectors. Ang sa akin lang po dito is let the people decide, give them the right information, give them the right access to right services, and in the end, it will be a matter of the life and death or the survival of the family. Ang sa atin lang po is bigyan natin sila ng pagkakataon na subukan at wag po natin silang ilihis sa tamang impormasyon.
Sir, you have emphasized to therefore, given all this data that would put the RMS in a cadastral, you have been out of the list of agencies as well considered up. Now, what did you emphasize to our similar particulars?
Ito po, yung na-achieve natin not only in the local but in the national level. Ang pinakamalaking nakamit po natin o nakuha ay yung respeto. Isa po yan sa pinakamahirap hingiin or kunin sa isang grupo ng taong negatibo ang dating natin sa kanila for a long time. Ngayon po nakamit natin yun. We were accorded with the highest respect, not only in the Department of Health but in many departments. And that is not only my own making. It is the unified effort of all health workers and those other stakeholders that believe na the Department of Health is doing the right thing for the people. So ito po yung nakuha natin na it took us a long time, 22 months in the making. At sa katunayan nga po, yung assessment is not being done by the Department of Health. It is being done by other sectors, like in the ARMM, as evaluated by the Office of the Regional Governor. It is Department of Health that tops the list in terms of governance, transparency, service delivery, and in terms of leadership. So, maraming bagay po na nakipagtulungan ang ating mga kababayan at dyan po ako nagpapasalamat sa kanila.
Thank you very much, Secretary.
Also, what is your message to the people of the municipality? Now they have their own hospital.
Yes, their own hospital.
To the people of Basilan, our people, my people, our brothers, my brother, and our sisters, my sister. For 10 years, you have been deprived of lack of hospital facility in your area. It has been there idle but non-functional. This is a realization of our dream. At sana po, tulungan nyo kami na panatilihin to maintain not only the service but the quality of services that we may be giving to the people. I want you to interfere. I want you to be part. I want you to suggest. I want you to be part of evaluation team. I want you to complain. I want you to tell us what's going on so that we may be able to serve you better. Ito po ay isang tagumpay hindi ng Department of Health, kundi ng mamamayan ng sumisip at ng mga karatig-bayan. Dahil po, kung hindi nila ipinarating sa amin ang kanilang situation, baka hanggang ngayon, hindi yan siya mabubuksan. At nagpapasalamat din po ako sa suporta na ibinigay ng provincial government sa liderato ni Governor Akbar at ni Vice Governor Sakahalon at saka lahat ng mga provincial board members at sa LGUs na bumubuo ng buong isla at probinsya ng Basilan. Sa mga health workers ko na walang sawa at walang pagod na naninilbi sa mga kanilang kababayan, taos-puso po ang aking at in behalf of the Department of Health ARMM, I saw the big challenge that lies ahead of us, and I also see the beautiful future that awaits us. Ito po, tulong ninyo mga kapatid natin sa media, you will play a big role by informing our public that hindi lamang kami naririto, hindi lang kami naglilingkod, kundi lagi kaming nagmamahal.